Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification, that is classification number 29. Sulfonamides or sulfa drugs and quinolone antibiotics. Sulfa drugs or sulfonamides and quinolone antibiotics. This classification is very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 28 videos on the classification part, and if anybody has not seen previous classification videos, please go in the channel's playlist and watch all the previous videos, because these classification videos, they are very important for your GPAT Niper DI Pharmacist exam. And believe me, a lot of MCQs they are going to be covered just by watching these videos, classification videos. Because in these classification videos, I have not only explained you about the classification, but also I have also explained you some other important points for these exams. So you have to watch this video, okay, once. Now first of all, what do you mean by sulfa drugs or sulfonamides? So they are the synthetic drugs, synthetic antibacterial agents. So there was a one dye known as a prontosil dye was broken down inside the body to get a sulfanilamide derivative, which was active. It was later observed that the antibacterial activity of prontosil is because of the sulfanilamide, right? So after that there was a lot of synthesis of these sulfa drugs. These sulfa drugs, they are known as a bacteriostatic drugs, and they are chemotherapeutic agents. What do you mean by chemotherapeutic agents, and what is the difference between chemotherapeutic agents and antimicrobial agents? अगर वो antibacterial drug जो है वो बैक्टीरिया से आया है, उसको बोलेंगे antibacterial drugs. And if that antibacterial drug is purely synthetic nature, अगर वो synthesis से आया है, synthesis करके आया है, तो उसको बोलेंगे chemotherapeutic agents. Sulfa drugs are nothing but the chemotherapeutic agents because they are synthetic in nature. Now these are classified according to their use. So first, sulfonamides which are used for systemic infection. जो systemic infection के लिए use किए जाते हैं वो. So in that you have different classes like short acting, intermediate acting and long acting. तो short acting में कौन होता है? In the short acting you have sulfadiazine, sulfadimidine, sulfacetamide and sulfamethizole. Sulfoxazole is also there. Sulfoxazole, okay. So that is the shortest acting. Sulfadiazine, sulfadimidine, sulfacetamide, sulfamethizole and sulfoxazole. So that is the short acting. Now intermediate acting, in that you have sulfamethoxazole. Sulfamethoxazole is the intermediate acting. And in the long acting you have sulfamethoxy, pyridazine, sulfadimethoxine, then sulfadoxine. यहाँ पे याद रखो, sulfadoxine is a long acting sulfonamide. So sulfadoxine is a long acting, and this sulfadiazine, sulfacetamide, sulfamethizole and sulfadimidine and sulfoxazole is a short acting. So out of that, sulfoxazole is a water soluble. We'll see it in upcoming slide. Now these are the drugs which are used for systemic infection. Now drugs which are used in the GIT for treatment of ulcerative colitis locally. So example is a sulfasalazine. Sulfasalazine ये जो drug है वो locally use किया जाता है GIT में. So sulfasalazine क्या है? It is a combination of sulfonamide plus salicylic acid. So after the reaching to GIT, it is broken down into sulfonamide and salicylic acid. And salicylic acid, you know that it has an anti-inflammatory activity. So it exerts anti-inflammatory effect in the rectum, right? Sulfasalazine. Now see this sulfadiazine short-acting drug, which is also broken down into your GIT by one enzyme known as azoreductase. तो azoreductase नाम का एंजाइम जो है वो सल्फाडाइजिन को ब्रेक करता है, एंड देन एक्टिव ड्रग जो होता है sulfanilamide that exert a antibacterial effect in the GI, right? Now sulfacetamide is a ocular antibiotic. Remember, topically used sulfa drug. तो ये जो ड्रग है topically use किए जाएंगे sulfonamides. So in that you have mepenide, silver sulfadiazine. So out of that, silver sulfadiazine is used for the burn therapy, topically for burn therapy. यहाँ पे अगर कोई burn हो गया या जल गया, so in that condition silver sulfadiazine, right? Now sulfacetamide is known as a ocular antibiotic or ocular antibacterial drug in case of ocular infection. Now, what is the mechanism of action of these drugs? So they, all these sulfur drugs, they are inhibitor of folic acid synthetase enzyme. Folic acid synthetase enzyme. Now, what is the role of this enzyme? This enzyme is involved in the conversion of para-amino benzoic acid to the folic acid. So this para-amino benzoic acid is converted into folic acid. That is done by folic acid synthesis. Now there is a little bit difference in this metabolism. Okay, in the humans में क्या होता है कि humans can utilize already formed folic acid or ready-made folic acid from the diet. Okay, but bacteria will not able to utilize this ready-made folic acid, so it has to synthesize its own folic acid by using PABA, para-amino benzoic acid. Now these sulfur drugs, they inhibit the folic acid synthesis enzyme and prevent the formation of folic acid in the bacteria. That causes the damage to the bacterial cell. That causes injury to the bacterial cell, and injured or damaged or disrupted bacterial cell is easy to phagocytosize by the our WBCs. जो WBC होते हैं वो damaged bacterial cell, injured bacterial cell को easily निगल लेते हैं, right? Sulfur drugs, they are ineffective in case of pus. They are ineffective in case of pus and tissue breakdown products. Why? There is a reason behind this. Now, in case of tissue breakdown product or in case of pus, there is a high amount of PABA. That's why, and PABA is nothing but the para-amino benzoic acid. And sulfur drugs also, they have similar structure with the PABA. PABA का और sulfur drug का structure similar होता है, and that's why they compete for the folic acid synthesis. तो जिसका ज़्यादा concentration होगा वो competition जीत जाएगा. So that is a competitive antagonism for the folic acid synthesis. Right? Theory of this mechanism, okay, that is a sulfur drugs are ineffective in case of pus and breakdown product of tissue, okay, which consists of highest amount of PABA, and this is known as a Wood-Fields theory. Now this theory is not applicable for one drug known as a mepanide. So this theory is not applicable for mepanide, right? Now sulfonamides, they have resistance, they have acquired resistance for the Staphylococcus infection, Streptococcus infection, Pneumococci infection, Meningococci infection, Gonococcus infection, E. coli. They can acquire the resistance to these sulfonamides. Streptococcus faecalis is also resistant to sulfonamides. Now we'll see the classification again. You can see over here, sulfonamides, they are known as sulfonamides. They are antibacterial drugs. They are known as chemotherapeutic agents, and they are classified into different classes according to their duration of action and special purpose. So short acting sulfonamides. पहला होता है short acting sulfonamides. So in that you have sulfadiazine, then sulfadimidine, then sulfixazole. These are the short acting sulfonamides. Now intermediate acting sulfonamides, in that you have sulfamethoxazole. Sulfamethoxazole is a intermediate acting sulfonamides. Now long acting sulfonamides, in that you have sulfodoxine and sulfamethoxyrazine. Now special purpose, so in that you have, they have already asked one question, एक बार क्वेश्चन आया था जी, longer acting sulfur drug, that is sulfodoxine is a longer acting, sulfamethoxyrazine is again a longer acting. तो यहाँ पे देखो sulfodoxine longer acting होता है, क्वेश्चन इसके ऊपर आ चुका है. Now special purpose sulfonamides, in that you have sulfacetamide, sulfasalazine, silver sulfadiazine and mepenide. So all these are used topically and locally. So out of that, sulfacetamide is known as a ocular, it is used in the ocular infection. Sulfacetamide is used in the ocular infection in the eye. Sulfasalazine, okay, then silver sulfadiazine, it is used for the burn therapy topically. Mepenide is also used topically. Okay, so this was a classification of sulfur drugs. Now we'll see classification of quinolone antimicrobial agents or quinolone antibiotics. In the quinolone antibiotics we have nalidixic acid and other fluoroquinones, right? So they are known as a DNA gyrase inhibitors. यहाँ पे क्वेश्चन आ सकता है आपको. और they are also known as topoisomerase 4 inhibitor. DNA gyrase inhibitor or topoisomerase 4 inhibitor. So they will have quinolone ring in their structure. Now those which have only quinolone ring, they are known as a non-fluorinated quinolone or simply quinolone. In that you have nalidixic acid. Now second, all these are known as a fluoroquinones. So इनके स्ट्रक्चर में फ्लोरो ग्रुप फ्लोरीन होगा and quinolone होगा. So that's why fluoroquinones. So fluoroquinones again they are classified into different classes. Some books have given only 2 generation, some books have given 4 generation. So we'll see first this, and after that we will see another classification. So fluoroquinones they are classified into first generation. देखो norfloxacin, ciprofloxacin, ofloxacin and pefloxacin. So how to remember this? You can see NCP. N मतलब norfloxacin, C मतलब ciprofloxacin and P मतलब pefloxacin, right? O मतलब ofloxacin. So NCP मतलब National Congress Party and O for office. So National Congress Party office. So first generation क्या है? National Congress Party office. N for norfloxacin, C for ciprofloxacin, O for ofloxacin and P for pefloxacin. Now these are known as the first generation. Second generation fluoroquinones. So in that you have levofloxacin, moxifloxacin, gemifloxacin, prolifloxacin and lomifloxacin, sparfloxacin. How to remember this second generation? Mox, Le, Gem. Moxi, ले लो, जेम. ठीक है, मॉक्सी को जेम्स देना है आपको. प्रोली लो स्पार. ठीक है, प्रोली लो. ठीक है, तो प्रोली को स्पा देना है और यहाँ पे मॉक्सी को जेम देना है. मॉक्सी को जेम लेना है, प्रोली को स्पा देना है. ठीक है, मॉक्सी ले जेम. मॉक्सी ले जेम मतलब क्या? मॉक्सीफ्लोक्सिन, लियोफ्लोक्सिन एंड जेमिफ्लोक्सिन. मॉक्सी ले जेम. ठीक है, और प्रोली लो स्पा. प्रोली को बोलना है कि आप स्पा ले लो. सो प्रोली मतलब प्रोलीफ्लोक्सिन, लो मतलब लोमिफ्लोक्सिन एंड स्पा मतलब स्पारफ्लोक्सिन. सो यू कैन सी द ट्रिक्स आल्सो. एक्चुअली आई डोंट बिलीव इन द ट्रिक्स टू मच. ट्रिक्स के ज़्यादा मैं फोकस नहीं करता हूँ, क्योंकि पहले तो आपको ट्रिक याद करना पड़ता है और उसके बाद में ड्रग याद करना. दोनों से अच्छा है कि डायरेक्टली ड्रग याद रखो, ट्रिक छोड़ दो. सो फर्स्ट जनरेशन यू कैन सी एनसीपी ऑफिस, नेशनल कांग्रेस पार्टी ऑफिस. एंड सेकंड जनरेशन तो मॉक्सी ले जेम एंड प्रोली लो स्पा. तो मॉक्सी को जेम्स लेने के लिए बोलो और प्रोली को स्पा लेने के लिए बोलो. ठीक है, सो सेकंड जनरेशन. नाउ मैकेनिज्म ऑफ एक्शन ऑफ your sulfa drugs. They are bacteriostatic, they are not a bactericidal. You have to remember. Now bacteria will synthesize a folic acid by using precursor known as a para-amino benzoic acid. तो ये पाबा जो होता है that is a precursor for folic acid. Now PABA is converted into dihydrofolic acid by the enzyme folic acid synthetase. So PABA is converted into dihydrofolic acid by folic acid synthetase. Now dihydrofolic acid is converted into tetrahydrofolic acid by the enzyme dihydrofolate reductase, and tetrahydrofolic acid is utilized by bacteria, right? But in case of human can utilize already formed folic acid. Bacteria cannot use or utilize ready-made folic acid, so it has to synthesize the folic acid from para-amino benzoic acid. Now conversion of PABA to dihydrofolic acid is inhibited by sulfonamides. Sulfa drugs are nothing but the folic acid synthesis inhibitor. Now conversion of dihydrofolic acid into tetrahydrofolic acid is prevented by trimethoprim. So trimethoprim क्या है? It is a dihydrofolate reductase. Okay, so that's why sulfa drugs and trimethoprim they are combined together. So you might have seen one very much famous combination known as a sulfamethoxazole and trimethoprim. Okay, known as a cotrimazole. We'll see it in upcoming slide. Now mechanism of action of your fluoroquinones or quinolone antibiotics. So you know that they are known as the DNA gyrase inhibitor. So normally what happens during the replication, जब replication होता है तब क्या होता है? During the replication DNA helicase will open a double stranded DNA at one end, but at another end, due to opening of double stranded DNA at one end to the opposite end of DNA, there is a super coiling. There is a extra coiling. So जैसे like a opening of rope. जो rope होता है आपका ट्विस्टेड रोप जो होता है उसको एक साइड पे ओपन करो, एक साइड पे टाइट होल्ड करो, दूसरी साइड पे क्या होता है? टेंशन आ जाता है. Because of the super coiling. Now after the replication that super coiling should be removed, otherwise DNA will be useless. So that super coiling is relieved by one enzyme known as the DNA gyrase. That is the function of DNA gyrase. Now all these quinolone antibiotics they inhibit the DNA gyrase enzyme and prevent the DNA from relaxation, and that DNA is useless, so that damages the cell. That's how they act as a bactericidal, right? Now once DNA is relaxed, there are some other antibiotics like when DNA is relaxed, DNA polymerase will convert into RNA. Now that is inhibited by this rifampicin by binding with the mRNA. So interfere with the DNA function. Rifampicin interfere with the DNA function, right? Now aminoglycosides, they are known as they inhibit the 30th ribosomes. They inhibit the protein synthesis. Okay, chloramphenicol inhibit the 50th ribosome, inhibit the protein synthesis. This aminoglycosides. Then chloramphenicol inhibit the peptide bond formation. Erythromycin inhibit the peptide elongation. So along with the DNA kinase inhibitor, I also explain you mechanism of other action, mechanism of other antibiotics. Now you can see dose and route of administration for some fluoroquinones. So norfloxacin is given by oral route. So it is preferred drug in a urinary and genital infection. Then ciprofloxacin, उसका brand name होता है Ciplox, or it is used in the treatment of most of the infections. So it is the most commonly used fluoroquinone. सबसे commonly कौन use होता है ciprofloxacin. Most commonly used fluoroquinone. Then pefloxacin is used. It is also used in the treatment of CSF infection. CSF में अगर होगा तो, so it has a good penetration in the CSF. Ofloxacin, so it is used in the UTI, urinary tract infection, respiratory tract infection, and gonorrhea. Also effect in the chlamydia infection. Then levofloxacin. तो levofloxacin क्या है? Levofloxacin. यहाँ पे देखो ofloxacin, वहाँ पे क्या है? Levo ली दग दे. So levofloxacin is a levoisomer of ofloxacin, right? Ofloxacin का ही levoisomer होता है levofloxacin. So it has a better activity against gram-positive bacteria and atypical pneumonia. Next one is a lomifloxacin. It has a long T-half. Sparfloxacin, it has a enhanced spectrum of activity against the gram-positive organism. Lomifloxacin has a long T-half. Sparfloxacin has a enhanced spectrum of activity against the gram-positive and atypical pneumonia. Gatifloxacin is a better activity against gram-positive, but it is no more used systemically. It is only used topically in the eye drops because it produces the arrhythmia. Provafloxacin again enhanced, excreted by non-renal mechanism. तो ये urine में excrete नहीं होता है, it is excreted in the by non-renal mechanism. Moxifloxacin again active against the gram-positive bacteria, anaerobes, and it should be avoided in the pregnancy. All these fluoroquinones, they should be avoided in the pregnancy. All these fluoroquinone antibiotic, they have post antibiotic effect. Post antibiotic effect क्या होता है? When there is a antibiotic is removed from your body, still growth of microorganisms are inhibited, known as a post antibiotic effect. Now we will see some few important points from sulfonamides. So all these drugs are a bacteriostatic drug. They are a folic acid synthesis inhibitor. They are ineffective in presence of pus because pus will have a high amount of power. They are ineffective in presence of pus or tissue breakdown product which has a higher amount of power. तो ये bacteriostatic होता है. Bacteriostatic मतलब they only prevent the growth of bacteria. They will not kill the bacteria. Sulfur drugs are metabolized by phase second metabolic reaction known as acetylation. तो acetylation से उनका metabolism होता है. And in the acetylation you know that there is genetic polymorphism. Acetylation में N-acetyl transferase enzyme जो लगता है उसके लिए जो जीन लगता है वो हर एक में अलग अलग होता है. That's why किसी में acetylation का कैपेसिटी ज़्यादा होता है, किसी में कम होता है. So depending on that, known as a slow acetylators and fast acetylators. दो टाइप के लोग होते हैं, slow acetylators and fast. Examples of drug which are metabolized by acetylation reaction. For example, sheep मतलब क्या? भेड़ी है ना, भेड़ बकरी जो बोलते हैं भेड़. So मेंढी जिसको बोलते हैं मराठी में sheep. So sheep means S for sulfur drug, H for hydrolyzine, I for isoniazide, and P for procainamide. So S for sulfur drug, H for hydrolyzine, I for isoniazide, and P for procainamide. So all these drugs metabolized by acetylation reaction. Now acetylated metabolite of sulfur drugs, they will have less water solubility, poor water solubility, and that's why they deposits into the renal tubules, or they can recrystallize in the renal tubule, and that's why they have crystal urea as a adverse effect. तो यहाँ पे सल्फोनामाइड्स का मेटाबॉलिज्म होता है एसिटाइलेशन से, और एसिटाइलेटेड मेटाबोलाइट जो होता है सल्फर ड्रग का वो वाटर इनसोल्युबल होता है और वो क्रिस्टलाइज होता है कहाँ पे? यूरिन में. दैट्स व्हाई सल्फर ड्रग्स हैज अ क्रिस्टल यूरिया. यहाँ पे याद रखना है आपको, क्वेश्चन आता है acetylated metabolite because sulfonamides are metabolized by acetylation reaction. Now one sulfonamide is there, sulfoxazole, okay, sulfoxazole. So that is the most water soluble sulfर drug and it is having least risk of schizophrenia. मतलब सबसे कम रिस्क होता है किसल्यूरिया का किसके साथ में सल्फिक्साजोल के साथ में because it is a water soluble. ठीक है most water soluble. Now again sulfadoxine is the longest acting and sulfacysteine. Okay, sulfacysteine is a shortest acting. याद रखो sulfadoxine longest acting होता है, sulfacysteine shortest acting होता है. Adverse drug reaction क्या होंगे sulfur drug के? Sulfur drugs have adverse drug reaction. No, you can easily remember one trick. You should remember ABC regarding the all rash of the sulfonamides. मतलब ABC of rash. sulfonamides क्या करते हैं? Rash produce करते हैं. So पूरा ABC आपको मालूम होना चाहिए regarding the rash produced by sulfur drug. So ABC rash. So A for aplastic anemia or bone marrow suppression. B for bilirubin displacement. मतलब these sulfur drugs they will displace the bilirubin from binding site from the protein, and that's why abnormal bilirubin level will be increased in your body. That is known as a kernicterus. You can remember the adverse effect of sulfonamides by just remembering this trick ABC of rash. मतलब ABC of rash. A for aplastic anemia, B for bilirubin displacement from the protein binding site that result in the abnormal increase in the bilirubin in the body, and that is known as a kernicterus in the children. Then C for crystalluria and rash. You know that rash means skin rash. Again in that, okay, skin rash is the most common type of adverse drug reaction of sulfur drugs. Skin rash is the most common type of adverse drug reaction in the sulfur drug. Then astallation, then systemic lupus erythematosus. Okay, systemic lupus erythematosus. So that is also again adverse effect. SLE. Systemic lupus erythematosus. Then hemolysis in the patient deficient with the glucose 6-phosphate dehydrogenase. जो भी पेशेंट में ग्लूकोज 6-phosphate dehydrogenase का डेफिशिएंसी है उसमें जितने भी ऑक्सीडेंट ड्रग होते हैं सो लाइक सल्फर ड्रग्स आइसोनियाजाइड फिनिटोइन जितने भी ऑक्सीडेंट ड्रग होते हैं सल्फर ड्रग्स देन फिनिटोइन देन हाइड्रोलाइसिन देन आपका क्विनिन क्लोरोक्विन प्राइमोक्विन सो दे कॉजेज द hemolysis in the patient deficient with the glucose 6-phosphate dehydrogenase deficiency. Right? Again, we'll see. This के ऊपर क्वेश्चन आ चुका है. Cotrimazole is a combination of sulfamethoxazole and trimethoprim. Cotrimazole क्या है? It is a synergistic combination of sulfamethoxazole and trimethoprim. Sulfamethoxazole 400 mg and trimethoprim 80 mg. So combination of sulfamethoxazole 400 mg plus trimethoprim 80 mg, and that is known as a cotrimazole. Okay, so it is a combination of sulfamethoxazole 400 mg and trimethoprim 80 mg in a 5:1 ratio. Okay, in a 5:1 ratio, there is a concentration ratio or dose ratio. Now after the absorption of this cotrimazole, the plasma level will appear like a 20:1. So 20 for sulfamethoxazole and 1 for trimethoprim. So ये क्वेश्चन ऑलरेडी GPAT 2021 में आ चुका है. So sulfamethoxazole 400 mg, trimethoprim 80 mg, that is 5:1 ratio. Now what are the uses of this cotrimazole? So cotrimazole has a one brand name known as Septran. Cotrimazole का एक पुराना टैबलेट आता है Septran नाम का. So you can remember the adverse effect. Also you can remember the uses of cotrimazole by using Septran trick. Septran क्या है? It is a brand name of cotrimazole. So what is Septran? Yes for STD. STD मतलब sexual transmitted disease like cranioid and other STDs. Cotrimazole is also used in STD. Then E for enteritis, intestine infection like sigilosis and all that. Then pneumocystitis. P for pneumocystitis. T for typhoid fever. Okay. R for respiratory tract infection. And A for acute urinary tract infection, and N for nocardia. So you can see Septran. Yes means sexually transmitted disease. E मतलब enteritis. P मतलब pneumocystitis. T मतलब typhoid. R मतलब respiratory tract infection. A मतलब acute UTI and N मतलब nocardia. So you can remember the uses of cotrimazole by this trick Septran. Okay. Now we'll see about the important points from fluoroquinones. So all the fluoroquinones they have a long antibacterial effect. Fluoroquinones will have a long post antibacterial effect. So normally what happens when there is a concentration of antibiotic in your body, at that time there is inhibition of bacteria. But when antibiotic is removed from the body, concentration is nil in the body, still some antibiotics inhibit the growth of bacteria. That is known as a post-antibacterial or a post-antibiotic effect, right? So fluoroquinones have a post-antibacterial effect, long post-antibacterial effect. Now, first, okay, fluoroquinones they are classified into according to the generation. First generation, so fluoroquinones first generation, so they have narrow spectrum of activity. फर्स्ट जनरेशन जो फ्लोरोक्विनोन्स है उनको नैरो स्पेक्ट्रम होता है एंड दे आर एक्टिव अगेंस्ट द ग्राम नेगेटिव ओनली इन दैट यू हैव नॉरफ्लॉक्सासिन एंड लोमेफ्लॉक्सासिन so nor and lom is norfloxacin lomefloxacin now second generation fluoroquinones so in that you have they are intermediate spectrum so first generation narrow spectrum second generation intermediate spectrum so in that you have ciprofloxacin and ofloxacin right now third generation fluoroquinones in that they are known as a broad spectrum fluoroquinones so in that you have levofloxacin gatifloxacin pifloxacin and sparfloxacin right so third generation they are active against gram positive also that's why broad spectrum gram negative plus gram positive fourth generation fluoroquinones they are known as the broadest spectrum activity in that you have moxifloxacin gemifloxacin provafloxacin and fluoroxacin and fluoroxacin and garenoxacin garenoxacin fluoroxacin and garenoxacin. These are the two drugs. They are belongs to fourth generation. Next point. What are the adverse drug reaction of these fluoroquinones? इसके ऊपर क्वेश्चन आ चुका है. So fluoroquinones they are able to cause tendon and cartilage damage. इसके ऊपर क्वेश्चन आ चुका है. So the damage is the cartilage and tendons, right? Also as a phototoxicity as adverse effect, they can cause peripheral neuropathy. Recently, FDA has warning regarding this. They can cause peripheral neuropathy, right? Again, gatifloxacin can cause dysglycemic effect and that's why it has been withdrawn from the market. Gatifloxacin क्या करता है dysglycemic effect मतलब कभी शुगर बढ़ाएगा कभी कम करेगा. The dysglycemic effect withdrawn. Now also gatifloxacin can cause cardiac arrhythmia, QT prolongation. Moxifloxacin can cause hypoglycemia. Fluoroquinones which are withdrawn from the market. Temafloxacin is withdrawn because of the immunohemolytic anemia. Provafloxacin is withdrawn because of the hepatotoxicity. Then grapafloxacin is removed from the market because of the cardiotoxicity and arrhythmia. Then cinafloxacin is withdrawn from the market because of the phototoxicity. Right? So you can order this magic bullet for GPAT Niper DI Pharmacist. Read 2-3 times before exam and qualify 100%. It's our guarantee. This is my contact number. We have very much promising results. You can see thousands of students they are placed in the Niper. You can also join our GPAT Niper 2024-25 crash course where you will have live lectures on Google Meet. Recorded lectures will also be available. Chapter wise and subject wise lectures are there. Study material hard copy will be there given to you on your address by courier. Then online test series will also be available. So everything is there in a 8,000. Now validity of this course is 2 years. And if you got all India rank below 20, the fees will be returned to you in the form of rewards.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100%